When I think of all the ways the healthcare field is trying to improve health disparities for minority groups, I sometimes think we could be doing one better. What would it look like to increase those minorities among healthcare workers? Anyone in the healthcare field is familiar with the multitude of diversity trainings for healthcare professionals. Maybe you've done something called the Privilege Walk or Harvard University's Implicit Association Test, and we know what it's for: to improve the glaring health disparities between racial groups of America. For example, pregnant black women have a 5 times higher ratio of pregnancy related deaths to live births than white women in Wisconsin. We can and should continue to create these bias trainings and anti racist policies in our healthcare systems. And while we do, what else is research saying about these disparities? Having same race healthcare staff improves disease prevention efforts, diagnosis, and health outcomes among minority groups. And yet, there is still an entire genre of workers known as the underrepresented in medicine. For young people of color and disadvantaged backgrounds, what are the barriers that are keeping them from being in healthcare careers at the same rates they have in their communities? The Journal of National Medical Associates found it to be lack of preparation, lack of funding, lack of support or isolation, and perceived discrimination. What is Central Wisconsin doing to decrease these barriers for Hmong people to join the healthcare workforce? Among Us, a kitschy name with a big impact, has held 3 consecutive years of twice monthly after school program for Central Wisconsin Hmong high school students to learn about health careers, gain access to networking and volunteer opportunities, as well as building communication skills for college applications, scholarships, and professional development. Through program surveying and active engagement with Among Us, my research has shown that this program is actively breaking down the barriers that keep underrepresented students from healthcare careers. Here are just small phrases that came up time and time again from these Hmong high school students. It will take a while to know for certain the impact this project has had on the Hmong population in healthcare. Even without that data, my hope is that we see healthcare diversity goals go from a framework that looks like this to something that looks a little bit more like this.